Good afternoon, I'm Dr. Small, and today we are going to be doing the arteries and veins of the cat. So before we get started, I just want to mention two differences between the arteries of humans and the arteries of cats. And the two differences are, in humans and in cats, we have an aortic arch. And in humans, we've got three branches coming off of that aortic arch. We've got the brachiocephalic, then we've got the left common carotid, and then we've got the left subclavian. In cats, we've only got two branches coming off of that brachiocephalic, or coming off, off of that aortic arch. We've got the brachiocephalic, and we've got the left subclavian. So when we get to the cat, the first thing we're going to notice is only those two branches. So let's come on over here and we'll just kind of take a little look at my poor handwriting, but again, we've got that aortic arch, and we've got two branches. So where is that left common carotid that would normally be in humans? Well, it's going to be coming off that brachiocephalic. So coming off of that brachiocephalic is going to be the left and right common carotid. So that's the first difference. The second difference, and then we'll get over to the cat, is that there's no common iliac artery in the cat. So what does that mean? Typically what happens is we've got that descending aorta, branches into the common iliac artery, into the external iliac, then our femoral artery, and right down to the leg. In the cat, we don't have that common iliac. So what we've got is we've got that aorta, branches into that external, and it has almost like this little tree shape. So this external iliac, which is actually going to lead down into the rest of the leg. So we're going to go into our external iliac, our femoral, our popliteal, and so forth all the way down our leg. If we go down a little bit, our internal will be going to our pelvis. Now, again, in humans, we've got that common iliac artery, but we don't have that in cats. So that's the second major difference. External and internal, no common iliac, brachiocephalic and left subclavian. So let's go over to the cat and let's take a look. See what we can find. So this cat's been dissected very well by one of our students, and just keep that in there. So we get a good look at a lot of those arteries and veins. So we're going to start with the arteries. And again, first thing we want to notice is this aortic arch. And here's our aorta. And if we follow it down, we can see here's the whole descending aorta. But let's stick with that aortic arch. And really nicely dissected, we've got two branches, brachiocephalic, left subclavian. Perfect, right here. So if we move these veins out of the way, the first thing we want to notice here is coming off of that brachiocephalic is going to be three branches. And right here we've got our left subclavian, we've got our left common carotid, and we've got our right common carotid. So, right subclavian, right common carotid, and left common carotid. And again, here's that left subclavian. So the first thing we want to do when taking a look at the arteries is get to the first two branches, and then we want to notice we've got three branches coming off of there. Right subclavian, right common carotid, left common carotid. Now, the subclavian artery, let's start with the subclavian. When it's a good landmark is going to be this rib cage. If the artery is inside the rib cage, it's going to be the subclavian. If it's outside the rib cage, it's going to be the axillary. So it's one continuous artery, but this rib cage is a good landmark to differentiate between the subclavian and the axillary artery. So we've got this subclavian, and the first thing that we can notice on the subclavian is coming off of there, we've got that transverse subscapular artery going off of the subclavian. And the second thing we can notice is, again, that continuation of that axillary artery. So we've got subclavian on the inside of the rib cage, and on the outside of the rib cage, we've got the axillary artery. We follow that down a little bit further. What do we have? Right in the arm, we've got that brachial artery. If we went further down, we'd have our radial and ulnar. But that's where we're pretty much going to stop. So the only thing I want to mention here, and it's going to be the same thing on the left side. Left subclavian inside, take it on the outside. Here's our axillary, and we've got our brachial. The only thing is the first branch off of that subclavian, and we can actually see it in this cat. The first branch off of that subclavian is going to be that vertebral artery, and you can always tell that vertebral artery. Well, first I should say it's a hard artery to find, but you can always tell it because it's going to dive down deep. That's that first branch. It dives deep down, and that's going to be our vertebral artery. So, in this cat, what we've done is we've cut away the diaphragm. And we've done that in order to have the continuation of the aorta. As we go down, so again, we've just finished the arteries of the head and neck. Now we're kind of going to the arteries in the mid-body, then we'll go to the arteries in the low body. So we've cut through the diaphragm. When we cut through the diaphragm, the first thing we're going to do is we're going to find one branch. And this first branch is going to be what's called the celiac trunk. First branch, once we've cut through the diaphragm, is going to be that celiac trunk. That celiac trunk has 3 branches that come off of it. And again, this is a really nicely dissected cat. Usually, it's kind of hard to see some of these, but in this cat, they did a really good job. First is going to be our hepatic artery, which is diving deep. Second is going to be there's our hepatic artery. Our second is going to be our splenic, and you can kind of see that's going to the spleen there. Let's see if we can't show you a nice clean spleen. Kind of a little bit messy in here. But a great way to tell that is a great way to tell if you ever get confused and you're in the actual organ itself is find out where that artery is going. Is it going to the stomach? Is it going to the spleen? So it gets a little hard, but if I find this, keep digging down, this to me looks like this is going to the spleen and this one's going to the stomach. So the best way to do it, the best way when you get into those organs is the artery that actually is by doing what's called either the pull test. Yeah, the pull test. Keep pulling on that artery until you actually get something moving. And in this case, we've got the spleen. So, back to where we are. First branch is the celiac trunk. We've got our hepatic artery, which is going to run all the way through the liver. Then we've got our splenic, and then we've got our gastric. Gastric being stomach, splenic being spleen. Next branch, superior mesenteric artery. Nice big artery, superior mesenteric, and it is going to the small intestine. So the way that we tell the difference between the superior and inferior mesenteric is where it actually goes. The superior mesenteric is a higher artery, and it goes to the small intestine, which has a smaller diameter, and the inferior mesenteric goes to the large intestine and large intestine has a larger diameter. So superior, inferior mesenteric. Small intestine, large intestine. Next, what we've got here, we've got our kidney. And again, what we don't see here is we don't see a renal artery, but we do see a renal vein. But I mean, it's pretty safe to say that if there's an artery that's going right to that kidney, you're going to think it's the renal artery or vein, right? So again, one of the nice things about doing the actual arteries in the organs is just pulling on the organ, and you'll actually be able to find out where the artery or vein is. So what's superior and medial to the kidney is going to be our adrenal glands. So let's see if we can find that. Remember, when we're looking for our adrenal glands, we're looking for that hard nodule. And you'll have to take my word for it, but I'm pressing on that adrenal gland. And you can actually see an artery and a vein going right to that hard spot. Excuse me. So we've got our adrenal artery and our adrenal vein right there, and that's going to our adrenal gland. So that's another artery and vein. The next one's going to be our iliolumbar artery and vein, and again, that's going to be going to the side of the lumbar spine, and it's going to be basically right before the aorta branches into the external iliacs, and it's going to be right here, and nice and clear picture of it, going right to the side of the spine. Perfect. Iliolumbar artery, iliolumbar vein, and our adrenal lumbar artery and our adrenal lumbar vein. Now, we've got our descending aorta branching into our external iliac, right? No common iliac in the cat, external iliac. Let's see. Take a look right down here, and then a little further down, we've got that internal iliac. So we got external, branch down, internal iliac going to the pelvis. Really nice picture of on this cat. Now, external iliac branches or goes into the femoral artery, which is going to be in the thigh, and then it dives deep into the knee, which is going to be the popliteal artery. Great picture here. Now, the only thing I want to mention, or the other thing I want to mention is, which would be lying superficial, would be your saphenous artery. And I don't think we can see it, but we can certainly see it in the vein. The saphenous artery or vein, which was basically, saphenous means superficial. So if it's laying on top of the thigh, it's going to be the saphenous. If it's diving deep, it's going to be the femoral. Saphenous being superficial, femoral being deeper. So, but what's really nice on this cat is you get a real clear picture of that external iliac and that internal iliac right there. And then you can kind of see those little tree branches. So, let's go to the veins. And when we're doing the veins, the first thing we want to take a look for is the superior vena cava. So our superior vena cava is going to be going right into that heart. Next thing we want to do is we're taking a look at that, and there's our superior vena cava. You can see that. Next, we've got we've got two brachiocephalics, real clear, real nice and clear again on this picture. There's our brachiocephalic branch here and our brachiocephalic branch here. So we've got brachiocephalic vein, superior vena cava. So, coming off of that brachiocephalic, what do we have? Well, we've got our subclavian. Inside that rib cage, subclavian vein. Outside that rib cage, subclavian artery, axillary vein. Going into the arm, brachial vein. So, same format with the artery as it is with the vein, subclavian inside, axillary outside, brachial. How would I test on that? Well, I would have to make it real clear that I'm right in the middle of the arm, or I'd go right on the outside of the actual rib cage to show you axillary. I'd be on the inside to show you subclavian. I've got to make that real clear, though. Back to our brachiocephalic. The next thing we can notice is we've got these great jugular veins, and these are going to be our external jugular veins. Great external jugular veins, brachiocephalic, and again, here's our subclavian. So we've got our brachiocephalic, and here's our external jugular, and then we've got our subclavian right on the inside, and depending on how far you actually push up, you can see the subclavian vein, brachiocephalic. We only have a little bit of a subclavian vein here, and then picks up again, and we've got our axillary vein here, and then we've got our brachial in our arm. So the veins are a little easier. The one thing, probably the hardest one that most people don't see, is the azygous vein. And what we want to do to find the azygous vein is we want to do a nice lung scoop on the right side. There's your azygous vein lying right there. Almost looks like on the other side of the aorta. What's that azygous vein going to do? Well, in case our inferior vena cava stops working, our azygous vein is going to take over. When we go back to the veins and we start going back to the lower body, one of the easier ones here, and one of the nice things is using that pull test and seeing that renal vein going to that kidney. Really nice picture there. What's this large vessel, which would be similar to the actual descending aorta? Well, that's going to be our inferior vena cava. So our inferior vena cava is going to go down. Now, one of the differences between the arteries and veins is that inferior vena cava is going to branch down, and now we are going to have a common iliac vein, and we are going to have an external iliac vein. So that's one of the differences. Again, remember, we don't have the common iliac artery. So let's see if we can't find it. Inferior vena cava. So here's those beautiful external iliac arteries, and we'll try to get rid of them. Not try to get rid of them, but we'll see if we can't move them to the side a little bit. And where that bifurcation is, and there it is. Let's see there. Can we see that, Amy? Yep, there's a bifurcation. Those are going to be common iliac veins. And then they're going to go into our external iliac vein, and then it'll go into our femoral vein, and then it'll go into our popliteal vein, and there's our saphenous vein. So, one more time. And you may be asking, well, how am I possibly going to know the difference? Well, I'll tell you how. If I'm going to test on the veins, and I'm going to use this cat, I'm going to tag right by that bifurcation. So you know it's got to be the common iliac vein if it's by that bifurcation, right? If it is right in the middle of the thigh, then it's going to be the femoral. If it's between the femoral and it's between that bifurcation and it's tagged, so somewhere around here, it would probably be that external iliac. So if you know the order, common, external, femoral, and you know where that thigh is, then you're going to be able to figure out the external. And of course, popliteal is going to dive deep into the kneecap, and we've got our saphenous, which means superficial. The only other thing I want to mention is, well, we talked about the adrenolumbar arteries and veins. They run together. They're going to be going right to that nodule. We talked about the iliolumbar. The only thing we can't see, because this cat's not triple injected, is we can't see the hepatic portal system. So we'll get out one day. We'll get out the triple injected cat and look at the hepatic portal vein, gastrosplenic, superior and inferior mesenteric. But last thing here, take a look at these renal veins. Right? When in doubt, always go to those organs, pull on them. Where they're going is what you're actually feeling. So, thank you for taking a look, and hopefully that's helpful. And next time we'll take a look at the hepatic portal system. Thanks.